Hello students, myself Dr. Ali. Today in this lecture I will be discuss about inflammations. This is the most important chapters, very crucial or essentially in your learning medicine. The learning objectives for the today's tutorial will be it will define what inflammation is. We shall talk about the types of inflammation and we will look into some historical aspects of inflammation, and we will see what are the steps of typical inflammatory responses, and then we want to understand the causes or stimulate for inflammation, and finally we will end with understanding the vascular changes in acute inflammation. Acute inflammation is very rapid onset. It can start within minutes or hours, whereas chronic inflammation is very slow. In those, it may take some days for the chronic inflammation to set. The cells involved in acute inflammation of polymorphonuclear leukocyte, that means neutrophils, whereas the cells involved in chronic inflammation are the uh, lymphocyte, the monocyte, and macrophages. And the tissue injury in case of a bit inflammation is mild. It is often self-limited, whereas the tissue injuries case of chronic inflammation is very severe and progressive in nature. The local and systemic sign in a case of acute inflammation, inflammatory response is very prominent, whereas it is less prominent in the case of chronic inflammation. So there are the basic difference between acute and chronic inflammation.